Hi, my name is Gibbons, and today we're going to look at correcting a sacral torsion, and this time it's gone into nutation. And what I'm going to say is that the left side palpates as deep into the sulcus, so the sacrum is rotated to the right, and it would be known as a right-on-right sacral torsion. And it would indicate by a lordosis. If you were to spring L5, then it would actually spring. But the sulcus will be deep on that side. So to correct that, we're going to perform something called the SIMS. A little bit awkward to set up for some patients, so be careful when you perform this. If I start off with the knee or knees in a 90-degree position, and if I cradle under, and if I slowly apply pressure here, what I want to do is bring my patient into rotation, and I want to cradle their knees onto my hip there. So that would be part one of the technique. But make sure that the feet clear the end of the couch. From this position, if we now swap our hands and palpate the L5, because what I want to try to induce, you'll notice that the patient is in right rotation. So if I apply a little bit more rotation there until I feel the L5 starting to increase its tension, and then I can change my hand back now, because if I induce right rotation to the lumbar, it's automatically going to try to induce left rotation to the sacrum, which is what it can't do because it's stuck forward, and I want to try to bring it back. Then the lumbar will facilitate part of that movement. Now swap the hands over, and now find the LS, the lumbosacral junction, until you feel the point of bind, which is just there. And then swap your finger into the sulcus, which should be deeper on that left side. And what we're going to do now is slowly take the legs down, so it's inducing side bending of the lumbar to the right, and then that will then induce side bending of the sacrum to the left. And then from that position, if I slowly ask you to push up on your both legs into my hand, this activates the piriformis for 10 seconds. And then the piriformis, because of its diagonal pull, will now pull the sacrum posteriorly on that side. Relax, please, take a breath. And as she breathes out, I will go further down until I feel the bind. And then I ask you to push up again, please. And after the 10 seconds, relax, breathe in. And as she breathes out, I bring the legs down. The idea of a piriformis is to cause that pull and cause a counter nutation into a neutral position on the left. And once more, please, push up. And then after the 10 seconds, and relax, and then hold the third and final position for approximately 25 seconds. After the 25-second position, I then bring my patient back into the neutral position, and then I would retest to make sure that the sacrum has now come to a neutral position. And that would be a SIMS position to correct a sacral forward torsion.